Cancer Screening Among Transgender Persons, an integrative review by Alyssa Desjardins, Julie Nada, Maria Quiring, Natalie Rodzinka, Lindsay Tippin, and Noor Zaweh, with faculty advisor Dr. Kate Kemplin. Transgender persons are individuals whose birth sex differs from their gender identity. Transgender is an umbrella term that encompasses several gender expressions, including, but not limited to, non-binary, gender fluid, and genderqueer. Cisgender refers to those whose gender identity matches their birth sex. Approximately 7% of the population in Canada identifies as transgender or non-binary. In Ontario, cervical, breast, and colorectal cancer screening is recommended based on provincial guidelines to detect cancer early and decrease morbidity and mortality. Transgender persons face complex barriers when accessing healthcare, and current literature suggests they are inadequately screened for common cancers. The purpose of this integrative review was to evaluate the current literature regarding cancer screening and identify barriers relating to screening non-adherence.
The updated methodology framework from Whitmore and Knaffel was used as a guide for structuring the literature review. The databases used in this search include CINAHL, Medline ProQuest, PubMed, and Google Scholar, and the specific search terms include transgender, non-binary, gender non-conforming, cancer prevention, as well as cancer screening. A decision was then made to only examine articles that discuss cervical, colorectal, and breast cancers to narrow our search. The inclusion criteria for this review included the use of articles that were peer-reviewed, published in the English language from any country, articles that specifically discuss transgender or non-binary persons in cancer screening, articles which discuss cervical, breast, and colorectal cancer exclusively, and articles published in the last 15 years. The exclusion criteria included articles that only discuss cisgender samples, articles discussing cancers other than cervical, breast, or colorectal cancers, literature from media, textbooks, or manuals, and articles which do not include statistical sampling, testing, or measurements.
To summarize statistical methods used, 30% utilized descriptive statistics, 27% utilized inferential statistics, and 43% incorporated both inferential and descriptive statistics in order to report data. 30 articles were chosen for examination in our review. 50% addressed cervical cancer screening, 30% addressed breast cancer screening, 10% outlined colorectal cancer screening, 3% discussed decrease in general cancer screening amongst transgender persons, and 3% addressed incidence of breast cancer among transgender persons. Of the 30 articles chosen, all but one article aligned with other similar studies in which the results showed that transgender men face more barriers and were less likely to obtain proper cancer screenings. Certain studies cited factors such as age, health insurance, lifestyle choices, and perceived healthcare biases, but not all studies included these variables.
We had originally set out to see, in the transgender population, what barriers affect cancer screening and how this affects screening rates and incidences of cancer. In regards to screening, breast cancer and cervical cancer screening rates are lower in the transgender population than in cisgender populations. Findings regarding screening rates were most often expressed as odds ratios when comparing to other populations, or as descriptive statistics. Several barriers to, or factors correlated to screening were identified. These are listed on my slide. Many barriers were interrelated. For example, insurance barriers were often tied to gender mislabeling, preventing appropriate screening and leading to anxiety. Lack of provider knowledge can lead to decreased provider recommendation for screening, which was a significant factor in screening rates. On the slide are some of our findings related to our secondary inquiry of cancer incidence in transgender populations. More extensive research on this topic would yield more results. Thank you.
Throughout the integrative review, it is obvious that a gap exists between cancer screening rates among the trans and cisgender populations. A major limitation and theme throughout this integrative review is that researchers do in fact use statistical analyses to depict a significant difference in screening rates among the trans and cis populations. They do not, however, explore why this gap exists in that particular sample or how the many covariants they previously identified have the potential to impact the results. Furthermore, we have noticed that at the beginning of many studies, researchers will state a possible rationale as to why that gap exists, but do not necessarily then proceed to study it. For example, in the Kieran et al. 2019 article, they hypothesized that the reason for the low incidence of cancer screening rates among the trans population is due to a lack of educational resources to both provider and patient. So in the study, they used a chi-squared analysis to quantify this difference, but there is no further discussion on how a lack of educational resources would be the culprit. Another major limitation is that researchers did identify the statistical test they chose, but the assumptions for that test are not always clearly delineated, leaving it up to the reader to assume that the primary researchers interpreted the rules and objectives for that test correctly. There were only a small percentage of researchers that actually identified the assumptions for the statistical test they chose. For example, Peitzmeier et al. 2014 used a Mann-Whitney U test and explained that it was the non-parametric alternative for the samples in their study which were non-normally distributed. Lastly, in terms of the sampling procedures, much of the data collected for these studies was through electronic medical records, manual chart audits, and/or existing cancer registries. However, it is possible and important to note that these studies may have misclassified trans patients if they had not come out to their primary care providers, or if the provider and patient chose not to document gender identity or gender transition in the chart.
Further research is required to better understand the needs of transgender persons living in Ontario and Canada and explore the barriers relating to cancer screening non-adherence. The current literature lacks high-quality randomized control trials evaluating the effectiveness of interventions to improve cancer screening rates among transgender people. Healthcare professionals should be educated on the health disparities faced by transgender people. Healthcare professionals require better education and training on forming therapeutic relationships with transgender persons to best assess each patient's individual needs in a safe, supportive environment. Additionally, government programs and initiatives should be developed and funded to target transgender persons for cancer screening. This concludes our presentation. Thanks for listening.